Thank you so much for coming. This is very exciting. My name is Julie Freilich, and I'm from New Gloucester. But I'm here as part of a new program that we call Community Connections. I think many people got something in the mail about this. So I am only one member of this team. We have a great team. With us today is also Lori Fowler and Cindy Slocum, who are our official community connectors. For individual calls that you may have or individual questions, you can contact them. And then we have a great relationship with the Southern Maine Area Agency on Aging and Mary Hadlock, who is considered our ambassador. So she's basically the person that answers all the questions for us. We just try and connect people with your questions and get you connected to either SMA or some other resources in the area. This is a brand new program. We're very excited about it. It's actually a pilot program. We're one of 11 towns that were selected to be a community connector. Come on in, just started. And this is a brainchild of the Governor's Cabinet on Aging. And they have started this program and are working in connection with the University of Maine Center on Aging to promote this as a pilot in a number of communities around the state. And the feeling was that really, in order to help people, you need people on the ground to be connecting one-on-one and understanding what the needs are of a community. So as part of our program for the year, we have decided to have a couple of these programs every year. So we're having this one today. We're starting off so we can all learn about the many programs that are the Southern Maine Area Agency on Aging. And we're also going to have one in early December, November 6th, on Medicare options for people that may be considering Medicare or considering a different Medicare option. So we'll keep you posted on those things. Maybe what we'll do quickly is just go around and say your name so we can all at least wave to each other. And we have a sign-up sheet going around. And then I'll let Mary get us started.
Wow, this is a great group. I wasn't expecting this many. I think the book club threw us over. That was going on. So, as Julie mentioned, my name is Mary Hadlock. I'm with Southern Maine Agency on Aging. I've been with the agency for 16 years. Can you all hear me okay? Yes. Okay. I have a tendency to talk fast. But I've been with Southern Maine Agency on Aging for 16 years, over 16 years. I came in as a resource specialist, moved up to working with Medicare volunteers, which I thoroughly enjoyed, then oversaw all of our volunteers, and recently moved into this position as the community ambassador, working with the age-friendly communities, towns and municipalities, letting them know about our agency, connecting with them, seeing how we can support the work that you're doing, as well as, being able to provide resources and programs. So that's why I'm here today, to introduce you to the agency and to let you know about the programs and services that we offer. So I really appreciate Julie and the community giving me this opportunity to meet with you today. Please interrupt me at any time to ask any questions, or if you prefer, holding them to the end, that's fine. I did bring a number of our brochures and flyers over here on the table, including one about the vaccine clinic that Julie mentioned that's going to be coming up on November 6th. We also have November 20th. The Medicare options is November 6th. See if I don't have my notes right in front of me. I'm doing this a little differently today. Normally I would start and talk and show you the PowerPoint, but we have a wonderful video that I think is a great introduction into our agency. So I'm going to try to show that to you first. I came early because I know how technology can be, so I'm going to start with that. And let me know if you can hear it, okay?
Key posture. A deep breath is always good to do.
I lost my balance after an physical episode that landed me in the hospital, and I got so weak. And this was the perfect thing to get me started again. And I've been able to gather strength in doing practically nothing, which is an amazing thing. It's like, oh, it actually helps. But yeah, it was good. This is good. I'm coming again next year, and we're going to all get together and practice during the winter so we don't lose that. You should try.
For 50 years, Southern Maine Agency on Aging has been the central resource for aging. There's so much to navigate as folks age, and we want to make sure that people know that they can call us anytime with a question, whether it's an older adult, an adult with disabilities, or a caregiver. We are here to be the focal point for services, information, and resources as it relates to aging. Many folks know us for Meals on Wheels. And since our inception as an organization, this vital program has provided not just a nutritious meal, but a wellness check for so many older adults in our community.
Good morning, Meals on Wheels. Yes, how you been?
I'm all right.
Good. You know, where I live in New York, there's nothing like this. That's the glory of this agency, is they provide services in the towns where they don't have any. There's a lot of older people in the town where I live, and so there's a line for volunteering, and museums are not my thing. So this is perfect for me.
It's not just for, the driving and volunteering. It's for helping out these senior people that don't get to see nobody on a regular basis. And when they see you once a week, they're so thankful for just seeing you that it brings a joy to your heart. It really does.
We know based on research and data that extended periods of loneliness has the same impact as smoking 15 cigarettes a day. And that's why we have programs like the Adult Day Program at the Sam L. Cohen Center. This program is a chance for people with memory loss or people with dementia to come and engage in activities, eat together, be connected. And as a result, they're more active, they're connected, they're engaged, and that leads to better health.
Hi, Pauline. We'll come get you.
The value of getting people out of their homes and into another routine to be with different people is transformative for them. It gives the family a respite, gives the members new friends, and enhances their life. Having a background in healthcare makes me maybe have a little bit of an eye to look at all the aspects of being a human, social and physical, and also emotional. How we all need to be with people, we all need respect, we all need to move our bodies and get out of our daily routines. And that is where this program shines.
So it was my mother's primary care physician who told us about the Cohen Center, and we were not sure what she would think about it. We were a little skeptical, but when she came in, she loved it right away. She was gung-ho, and she comes 3 days a week, and she very, very rarely says, I don't want to go.
And she just loves it.
Yeah.
She talks about all the people, all her friends, the crafts.
Yeah.
Yep. It's the best thing we could have ever done.
Many years ago, both my mom and dad came through the daycare program, and they did such a wonderful job caring for them. I thought it's my place now to help out in our community, and that's why I come here every day. We're gonna use our karate skills, okay? You ready for the karate skills? I can't say enough good things about the program and the agency. Life has been good, and I just think sometimes we all need to pay it forward, and I think that the Southern Maine Agency on Aging is a good place to start.
At Southern Maine Agency on Aging, we believe in a just, inclusive, and equitable world when it comes to how we care for older adults and their caregivers. And that's why we know when older adults are embraced, valued, part of the fabric of our communities are healthier, and in turn, the state is stronger. And as a nonprofit, we rely on the generous support of donors, corporations, volunteers, staff members, our wonderful towns and municipalities, foundations, to really keep this work going. We hope more and more people will become involved in the years ahead, because it is only thanks to our community that we can care for and embrace older adults like we do.
That is the first time, I think, that we've ever been to a presentation and it's gone off seamlessly to be able to show a video. So yay, thank you for being so patient with me today. So I'm going to bring up the slideshow. Exciting news that I'll share with you first, and that is that in addition to our adult day program in Biddeford that you saw here in the video, and I'll talk a little bit more about that in a moment, we are expanding our operation, and we just opened a hub recently, found out that Phyllis is originally from Springvale, in Springvale, at the Anderson Learning Center. And anybody that's familiar with the Sanford-Springvale line, it's behind the old courthouse building. And that also has one of our adult day programs. And we will be expanding to the greater Portland area, actually Portland, in 2025. And that will also have an adult day program as well, too. I'm really proud of the work that we do, all of our work that we do. But it's especially exciting to see the expansion and being able to work with these adults. So, any questions so far about the video? Yes? The Stewart Center was in Falmouth, and that closed. And so we just had the Cohen Center down in Biddeford. So we closed that pre-pandemic, I think it was. Yeah, that we closed that. We used to have another facility in Falmouth. Thank you for remembering that, at Ocean View. And yeah, that did close down. So without further ado, so I wanted to just give you an overview of our agency. Our mission is that we are the focal point in Cumberland and York counties for resources, services, information to not help, but to empower older adults and adults with disabilities and their caregivers to live to their fullest potential. So not only do we serve older adults, we try to refrain from using the word seniors. I don't know how you feel about that, or the word elderly, but we do try to refrain from that. Our values are that we are community-centered, innovative, belonging, client-centered, impact-driven, and team-oriented. So these are some of our highlights. These are numbers. If you're a number person, you'll love this because this shows you in black and white some of the impact that we made from our fiscal year last year. And that is that we delivered over 230,000 meals through our Meals on Wheels program. In addition to that, we served over 91,000 meals in our congregate dining. You do have, in your community here in Gray, the Parks and Rec, you have a dining site, one of the congregate dining. If you haven't checked it out, you may want to do that. It's on the second Wednesday of each month. Second Wednesday of each month at noon. Yes. Noon. And with our adult day program, we provided over 18,000 hours at the adult day program, and that's giving over 15,000 hours respite to families, to family caregivers. A lot. We provided, as Phil used to do, one-on-one Medicare counseling to over 1,300 individuals. Especially proud of our Medicare volunteers. They've been at this for a long time. They're all state health insurance program certified volunteers. They take an exam every year to remain that. They're highly trained. We do not sell insurance, but rather we provide folks with the options that they have for their Medicare. And we supported almost over 6,500 folks who call into our agency on our information and resource line with questions that may be about legal assistance or housing or food or just other things. So any questions about that? No, I'm good at questions. So, so some of our programs that we do certainly help to meet, urgent needs, address social isolation, and oftentimes, that's worked into programs. I mean, in addition to our Meals on Wheels, it also, besides offering a nutritious meal, it's also helping to address that wellness check that folks need or whatever. We do work with people of all populations, low income, people of the BIPOC community, Black, Indigenous communities, individuals in rural areas. Greater Gloucester is considered a rural area, and adults with disabilities. So going back to our adult day program, and I did want to print up. Let's get my notes here. Oops. So with our adult day program, I thought I had my notes here. I don't have them. It is designed for folks that have memory loss or cognitive impairment, people with cognitive impairments, primarily age 60 or older. We do serve folks that are under age 60 in that program as well. There's different funding streams for the adult day program. There may be some state funding. Some folks have long-term care insurance that helps to pay. If you're a veteran, there's some funding through the Veterans Service to help provide for adult day. And we also certainly accept private pay as well for that program. And so there are constant activities for the folks that attend. We don't call them clients, we call them members at the adult day program. We consider them to be part of a club, and so we call them members. And they have activities that are geared towards just various activities. It could be from music. We have pet therapy that we offer. There's also games, other activities. There's a quiet room. I'd love to encourage any of you that may be interested to come and visit our Adult Day Center. We're at 30 Barrow Road in Biddeford, and the one in Springville, I don't know the address to that yet, but it's the Anderson Learning Center, and certainly. But if you'd ever be interested, please contact myself or let Laurie or Cindy or Julie know, and we'll be certain that we can set up a tour for you. The rest of my notes. I must have missed that whole thing. Any questions about our adult day program before we move on? Right now, Biddeford is our only location, except for the one that we just opened up in Springvale. And Springvale's next to Sanford in that area. But we will be, in 2025, opening up a hub location in Portland that will also have an adult day. We'll be able to have appointments out of that office, do some of our classes out of that office. I expect one of our meal sites will also be out of that office as well.
Can you repeat again how you would pay to attend?
To attend the adult day. There's different funding sources, so certainly depending on your situation, you'd want to connect with the social worker there at the adult day program. But there's always the option to private pay for adult day, but there's also some state funds available to help. Some of the programs that we have a respite program that I'll talk about, and that is based on income. There's some asset test with that, but that can help to be used to help to pay for adult day. And then in addition, there's also, if you're a veteran, there's some funding through the veterans for that as well. Any other questions about the adult day program? It really is, it's amazing. Prior to that, we had our office in Scarborough, so when during the pandemic, we sold that building, moved to the adult day in Biddeford, and I have to tell you, it's really been an eye-opener when we've been there, and just hearing all the activity and the fun that they're having in the adult day program. There's always something happening. They just keep all the members thoroughly engaged, and they just have such a great time. I just smile to myself whenever I'm sitting there or singing along with them when they have their song programs, the music programs, but it's just a wonderful program. I can't say enough good things about it. Yes. Not yet. It's going to be probably in the Congress Street area. Yeah. It's not official yet, so I can't, yeah. You're putting me on the spot, but that's what I can tell you. It's yeah. I couldn't tell you whether it's out or not. I just know that that's like the location, general location of it. It hasn't been signed and the ink hasn't dried yet, so.
That's still far for us and gray.
It is still really far, I know. One of the nice things about this project is being involved with the other area agencies on aging. there's a community ambassador. There's 5 area agencies on aging in the state, and there's a community ambassador for each of those area agencies on aging. And finding out the other programs, because I know Lewiston is closer probably for you than it would be to drive down to Portland or certainly to Bedford or Springville, which are far, but maybe the plan is that there'll be something else opening. You could certainly always call the agency to find out what other adult day programs might exist in the area. Off the top of my head, I don't know. Absolutely, connecting with Cindy and Laurie to find out about what resources are available. If they have questions, they can always reach out to us. Again, our role here at the agency is to support the work that your community is doing. And, it's up to you to let everyone know what it is that you'd like to see within your community. So well said. Thank you for that. So in addition to any other questions about the adult day before I move on, again, I mentioned all the activities that they have. There is an outside patio there that members can benefit themselves of. They have baking, they do exercise, gardening. There's an outdoor garden for them. It's just a great spot. And our family caregiver also certainly complements our adult day program. We offer many, can you all see that okay? Yeah. Many programs and services through our adult day. We have support groups. We have Savvy, which is an evidence-based support group for caregivers. And then we just began a wellness series. It is virtual. Hopefully we'll be able to expand that to offer in person, but there is a virtual series right now for wellness for caregivers. I mean, caregiving, if any of you are familiar or have cared for a loved one or family member or friend, can be very stressful. So understanding how to care for yourself during that time period is extremely important. So that's what the wellness series is designed to do. And in addition to that, we have our classes that we offer for support groups, for caregivers as well too. And then we have many older adults are also caring for their grandchildren. And so we have kinship groups too for those caregivers that may be caring for an older adult, but also caring for some grandchildren as well too. Any questions about that with our caregiver program? I did want to mention, you'd asked about the funding. There is, and I have some flyers over there about Respite for Maine. There are some funds available through the state. It's about $5,303, I think it is, and you receive up to 80% of reimbursement for those costs. But those costs can be used to help pay for adult day. It can also be used if you need some respite and need to place your loved one or a family member or friend in a facility for a few days. It will help to offset those costs as well too. And in some cases, you can use that for home modifications. That's really something to be addressed with the program manager. But those funds are available. Oftentimes, folks aren't aware that there are funds available out there to help for caregiving. But I do have some flyers over there talking about the respite program. There was just another grant that just went through, and I'm hoping that they bring it back because that was a great program. So any questions? And I will tell you, if any of you have any questions about caregiving, need to find some resources, our family caregiver, the staff that oversees that program, are just so knowledgeable. They have so many years of experience between them. I wouldn't hesitate to have you reach out to them with any questions, small or big, or just if you're looking for resources, wondering about, what's the next step for housing? How do I find out about long-term care? How do I find out about assisted living facilities or, nursing facilities? Oftentimes there's a wait list for those programs, so that's something that you may not think about planning ahead, but something that you would want to plan ahead for. So they're just an amazing source of knowledge. Community services, I consider this basically as the front line of our agency. When you contact our agency, you're connected to our resource specialist in community services. So if you call and you're interested in finding out more about Meals on Wheels, if you have questions, again, about any legal assistance or housing, or want to find out about the respite funds or whatever, you would start with our information and resources, our community services program. We have 2 programs in that. There's one that take all the calls, and then we have what we call short-term case management, where they can actually go into the home and provide some short-term management if necessary, if someone is unable to get out and needs help filling out applications. I brought information over there about, for example, fuel assistance or what have you. That's also something that I think Cindy and Laurie will be able to assist you with as well. If you need that type of assistance, you can come to see them as well too. Under this program, there's the 3 additional programs with community services. There's our Medicare program. Our Medicare volunteers, again, I mentioned, are highly trained. They're certified through the state every year before they are able to counsel. We do not sell insurance. We do not represent any company. We offer unbiased, objective counseling to clients that come to see us. It is Medicare open enrollment period. What's today's date? Is today the first day of open enrollment? No, it's today. Yesterday was the first day. October 15th through December 7th, for those of you that are on Medicare, is the time of year that you have to be able to review your insurance every year. You can call our agency. We offer in-person appointments, but we can also do them over the phone or virtually via Zoom. I would take advantage of this. As Phil can attest, we've been able to save folks thousands of dollars annually on their prescription drug plans, or just being able to, just by going through a review of what your current insurance is. Oftentimes, formularies change. Your prescription may not be on the formulary from the insurance that you had last year, so you may want to think about switching. The other thing that I wanted to mention about that is that there's also some programs out there called, one, for example, is the Medicare Savings Program. I have flyers over there about this. This program, there is income guidelines for this. They just increased the guidelines for this program. There's no asset test and there's no estate recovery attached to this, but it helps at the very least to pay your Part B premium. Last year it was $174. Don't know if that's going up this year. I haven't heard yet. But at the very least, you would get that reimbursed into your Social Security check. That's a huge savings. On average, folks that are eligible for this program save over $7,000 a year. So it's something that if you think that you're even close to meeting the guidelines, and again, I brought the paperwork here to talk about those guidelines. Again, no asset test with this. I would absolutely apply. It's the Department of Health and Human Services that administers and oversees this program. But again, it's something that if you think that you're eligible for, there's all kinds of disregards. If you're married, you can make more money, et cetera, different things to be looking at for that. Any questions about that? One last thing with that program, if you are eligible, it provides you with an ongoing enrollment period a few times a year. So you're not locked into this open enrollment period that ends on December 7th. Yeah, we have various locations. We have the one closest to here, I believe, would be in Wyndham right now for a location. Again, with more volunteers, we can always expand to other places, but right now I believe Wyndham's the closest. And if someone has difficulty getting out of their home and needs this counseling, isn't able to do it over the phone or over Zoom, we do have our resource specialists I mentioned that try to get out into the homes and provide help with that. Steph, you're welcome. So the other program we have is our Money Minders program. Our Money Minders program is a financial bill paying assistance program. It is by volunteers that go into the home. The client must be able to direct the volunteer. We do not sign the checks. The client has to be able to sign the checks. We can help them write their checks. But what it's designed to do is for folks, if you need help balancing your budget, creating a budget, balancing your checkbook, that's what this program is designed to do. So if you know of someone that could benefit from this service, again, just let Laurie, Cindy, or myself know, or Julie. And then we also have our Phone Pal program, which is our telephone reassurance program. And this program is designed to help decrease social isolation and loneliness. It's a friendly call. It varies from the wellness checks that you may have heard of that police departments do or emergency services do. Excuse me. So this program is designed to offer a weekly call with the client and the volunteer. And it's matched. Part of the success for this program, I believe, is that it's matched based on interests. So Cindy, if you're interested in the opera, you'd be matched with somebody who may be interested in opera, or if you're interested in sports or animals or what have you. And I think that's one of the reasons why this program has been so successful. This program started in 2018, and it was actually born out of when we reduced the number of delivery days for our Meals on Wheels program. We used to deliver hot meals 5 days a week. And then we went down to 3 days a week, still providing a hot meal. Then we began to work with a vendor and provide flash frozen meals that are now delivered twice a week. I'm getting ahead of myself. But anyway, I was going back to the Phone Pals. So when we reduced the number of days for that meal delivery, we still wanted to be able to have that check-in with the clients that we were working with or seeing. And so the Phone Pal program was born. And it really has been very successful. We are always desperately in need of volunteers for this program. So if you're like me, you like to talk, we'd love to have you call us and be interested in just offering a call to someone and just chatting with them for 15 to 30 minutes once a week, or depending as often as you'd like to do it, or you and the member. We do have a system in place that protects your privacy. Your phone number gets funneled through that. And so it's been a really great program. Any questions about our Phone Pal, Money Minders, or Medicare counseling? Medicare Savings Program. I'm that good that you guys don't have any questions? What? Wow, wait till I go back and tell them this in the office. They won't believe it. So, and this is one of the things that Megan Walton mentioned. And again, how many of you are familiar with or heard of Meals on Wheels? How many of you knew that Meals on Wheels is associated with Southern Maine Agency on Aging? A few. It's always interesting to me to see that dynamic. But the Area Agencies on Aging came from the Older Americans Act in 1965. And all of the area agencies on aging are mandated to offer specific programs and services. And the one that most people are familiar with are Meals on Wheels. So whenever you see Meals on Wheels, you know that they're associated or affiliated with the Area Agency on Aging. So you saw the number in the impact that I showed you earlier of the number of meals that are delivered. Meals on Wheels are delivered to older adults age 60 or older. We can also provide meals to adults under age 60 who are receiving Social Security disability. And caregivers, a live-in caregiver of a recipient for Meals on Wheels is also eligible. There is no income guideline. Let me repeat. There is no income guideline for the Meals on Wheels program. We do request a suggested donation for the meals of $3.50, but no one is ever turned away for inability to pay for that. Our meals are flash frozen. They deliver the meals on Tuesdays and Thursdays. They can deliver up to 5 meals a day. During the winter or during stormy weather, we have storm packs that provide them with an additional number of meals for them to access. I'm just trying to find my other notes about that because I know I'm missing a bunch of stuff. Oh, not even on this. I wrote down lots of notes because this was, again, the Meals on Wheels program is designed primarily for folks that are homebound. Does not mean that the person can never get out, or those folks that may have difficulty preparing a nutritious meal. And yeah, I think I mentioned, in addition to the frozen meals, which consists of a protein, vegetable and a side dish. There's a loaf of bread and milk, too, that's delivered with it. We have the majority of our volunteers at the agency. We have about 400 approximately work within our Meals on Wheels program. We couldn't provide the services and programs that we do without our volunteers, without the assistance of our volunteers. In addition to that, we have our community cafe. As I mentioned, the one closest here is at the Great Parks and Rec. It's on the second Wednesday of each month at noon. Those are for Maine residents age 60 and older. We do request that you reserve a spot if you know that you're going to be attending that. And if you can pay, there is an $8 suggested donation for those meals. It's a way for you to get out and enjoy each other's company while also having a fun dining experience. We do serve those under age 60, or if someone is an out-of-state resident or does not want to register, but we ask them to pay the full price. Then we also have the As You Like It program. The As You Like It, am I getting it? Oh, okay. It's for adults age 60 plus that you receive a card, looks just like a debit card, and we can pre-program that card for up to 10 meals at a participating restaurant. Right now we're looking for restaurants to expand that program. The closest one to here I checked before I left was Chia Sen down in Scarborough. Again, it's a little bit distant, but they have great food. If you've never been there, I would highly recommend it. There's also Jaffa in South Portland, the Golden Rooster in Saco, and there's one more that I'm missing. But we are looking to expand. I hope that if you have any ideas or suggestions or know of some place, there was a new place in New Gloucester. What was the name of that, Julie? I forget that I haven't. Yes. Yeah, have you been there? Have you? Yeah, so I'm going to ask them if they'd be interested in participating in this program. Again, I think it's a great way to get out, meet with friends, have a meal at a reduced price, and you don't have to worry about bringing cash with you. You just need your card. You can get that at our meal sites in age 60 or older. Mm-hmm. You can get a prepaid card. Yep. Again, suggested donation, $8 for those cards. Right? Yeah. Absolutely. Thank you for bringing that up, Cindy. Yes, you could buy that for a gift for a friend, or, that'd be great. But right now there's not many places in the area? Not yet, but they're really working hard to expand upon that, program. Suggested donation, again, it's a suggested donation for this. You get a prepaid card. Usually it's a limited menu for that, but it depends on the restaurant. Yeah, but again, that depends on the restaurant. They may have several options for you to choose from. You get it at our Meals on Wheels sites. Mm-hmm. Or contact our agency. Yes, and then I'll also show you our website too before I leave here today. So I just want to make sure I'm not going over my time here. Okay, I thought I was talking fast. It's a great program, and like I said, if you have ideas or places that you think that we could expand to, we'd love to hear from that. And then the last but not least is our Simply Delivered Meals. This is for anyone. It's not limited to those old over age 60. It's there's $7 a meal. And you have to request at least a minimum of 3 meals. But this is if you know, for example, that you're going in for some type of surgery, knee replacement surgery, and that you're going to be out of commission for a few days, coming home from the hospital, the last thing you're going to want to do is cook. That you can call the agency to have these meals delivered. I will tell you that some insurance companies also help to pay for some of these. So something for you to look at when you're looking at your Medicare coverage. Simply Delivered. Generally it is. Mm-hmm. Yeah, they're flash frozen. Yes. Mm-hmm. Yeah, and you can order up to 7 meals at a time. They deliver on the Tuesdays and Thursdays. It's usually delivered by Meals on Wheels volunteers. So it wouldn't be good for surgery if you need 3 days. Yeah, because they're frozen. You're putting them they go right into the freezer. So you can order up to 7 days at a time. So you could get, 2 weeks worth of meals if you knew that you were going to be laid up for a specific time. Is that not answering your question? Okay.
That's okay.
Okay.
I believe they're all microwavable.
They're all microwavable.
They're all, you just take them out of the freezer.
They're flash frozen.
If you get the Tuesday, Thursday, and you get, say, 7 meals, are they going to be the same meatloaf and potatoes?
Oh, not,
Or
No,
are
you-
they 7 different meals?
They're different meals. You can choose.
Oh,
Yeah, you can choose what meals you want to have delivered on that program. Yeah. And I will tell you, we've tried all the meals at the agency. It's Birch Stream Farms is our vendor, if you've ever heard of them. It's really very good. They're really good. They have some great choices. And again, they meet dietary restrictions if you have any. There's gluten-free, dairy-free, et cetera, if you have any dietary restrictions for that. So that's our nutrition program, if you have any questions about that. And then also we have our wellness program. We offer classes, matter of balance for falls prevention. Many of you, I'm sure, are aware that, one of the most frequent calls to EMS is for folks that have fallen. And so with the matter of balance, it's not only the exercise, but it's also teaching you to be aware and mindful and prepare, kind of removing those scatter rugs that are not firm down on the ground. I know if you have them in your home, they're not good. It's not a safe thing, but it really is a wonderful program designed to help folks to think. This is a true story. My daughter's mother-in-law was carrying laundry, wasn't paying attention to what she was doing, walked up a step, tripped and fell, wound up with 14 stitches, 7 in her head, in her hand. I mean, it was one of those things, and so I had suggested maybe you would think about, because again, this is something that can be offered through all the area agencies on aging. She lives out of the state and is now looking into taking one of these classes, just to be mindful about the fact that you need to slow down, be aware of what it is that you're doing, and be careful. Something that I know we all know, but oftentimes. Julie, did you have a question?
Where are they offered?
The Age Well classes right now are offered in various locations. I'd have to get on the website to see where the next ones are going to be.
Is it possible to bring like a matter down program up?
Yeah. I was just on a call this morning for Wyndham right now. Again, we're limited to what we can offer based on the number of volunteers. We have master trainers for this program. They go through in-depth training to become a trainer, but we're always looking for folks that may be interested in becoming a trainer. But right now, I can't say specifically that we'd be able to bring one to Gray and to Gloucester, but we're looking to expand the program, and hopefully we will be able to do that in the future. But we're always looking for folks to volunteer, to bring that to their communities. As Cindy mentioned, that's one of the things about working together. Then these are things that we'd be able to offer in our community. So we do offer Tai Chi in addition to, it's a beautiful program. It's really very artistic. It's a work of art. It's the Dr. Paul Lamb for Arthritis program. It's an evidence-based program as well as matter of balance. So it's been tried, tested, true program that helps folks, again, along with balance, is another great program. And, I know there was, and we also offer another program, Gentle Exercise. We can offer this program virtually, and we also did have some yoga that we were offering. Some of these programs can be offered virtually. I believe we tried Matter of Balance virtually, and I just, know that they're looking to expand those programs as well. Thank you for that. Anything else, Cindy, Laurie, to add? No? Again, I mentioned our volunteers. We have a really robust volunteer program at the agency. Phil can attest to this, was one of our volunteers. In all of those programs that I mentioned previously, we really rely very heavily on our volunteers. We are one of the 3 AmeriCorps senior programs. We're RSVP, which stands for Retired Senior Volunteer Program. So any volunteers age 55 or over that volunteer automatically become an AmeriCorps senior member. The other 2 programs you may have heard of are Foster Grandparent and Senior Companion. Southern Maine Agency only sponsors RSVP. The other 2 programs are sponsored through Opportunity Alliance. There are stipended positions for the Foster Grandparent and Senior Companion. If you think that that's something that you might be interested in, you would want to contact Opportunity Alliance for that. So in addition to the programs that I mentioned within the agency, we also partner with other organizations to be able to offer our volunteers a myriad of exposure out in the community. So it may be hospice for Southern Maine, Maine Medical Center. We have a number of additional organizations that we work with to offer really unique volunteer experiences. So there is currently ITN and RTP, so ITN, Independent Transportation Network, and the Regional Transportation Program are both programs that you may be able to receive transportation for. Transportation is probably the #1 request that we receive. And so one of the nice things for the agency is that now we can refer folks back to their local community, such as New Gloucester, for their transportation program when we get calls from folks within the community that need help getting to their medical appointments. But many surrounding communities as well, too, are also offering transportation programs. So always looking to expand upon this. I don't know that there's a waiting list for that program. It's just about, yes, they would cover Gray and New Gloucester, yes. But, again, it's about being able to schedule those rides. You have to be able to do it so far in advance. A few of them, you have to basically buy into those programs with, a small fee that's charged for that. I believe, and Cindy, you may know this too, if you need any accessibility, I'm not sure what they offer for that. You may be limited with that too, as well. So these are some of the gaps in coverage that we do not, as an agency, offer. We don't offer a transportation program. Not to say in the future, maybe. I know that there's a solution to this transportation program, and hopefully we'll be able to fill that need at some point. But homemaking service is another program. We refer you to organizations that provide homemaking services. We do not provide it, but there is, through the state, Elder Independence of Maine, that if you are assessed and require that, you may be able to get homemaking services through the state. Very limited, the number of hours that you would get through that. A lot of folks think that, if I need that assistance, I'd have somebody come in 24 hours or whatever. That's very rare, if not ever happening. Oh, thank you for bringing up Catholic Charities. That is another great resource. So while we don't offer that as a resource, we'd be able to connect you with organizations that do offer that. And it may be private pay as well for that. And so if it's that you may need some homemaking assistance, help getting dressed, maybe help bathing, maybe housekeeping assistance, preparing meals, etc. But then if you need some higher level of care, if you need maybe an assisted living level of assistance, then they would also come in to assess you for that, and then you'd be able to apply for that type of service, or a nursing facility level of care. But again, it's a very comprehensive assessment that they come in to do at the state level. I talked about that through the respite program, that there might be some funds available through that. Again, it's at the discretion of the program manager for those. That's through that respite for me, the caregiver for me, funds that may be available. Again, we do not offer, many of you have been around for a long time, are familiar with the agency. We used to have what we call a fix-it program, but now we're looking back to the local communities if they have groups that are willing to go into the home to maybe do some small jobs, maybe install grab bars or whatever for folks. They can help with that. But also, you'd be able to contact our agency, and if we know of folks that would be able to help or assist with that. Alpha One also offers assistance if you need help with any, just completely lost the word, sorry about that. Adaptive equipment, thank you. Yes. Right, ramps, or even just even, you know, if you need some equipment for your hard of hearing or being able to, you know, need large things for your fingers or whatever with the phones, et cetera, that type of thing. They're able to offer assistance with that. And these are all the other organizations that we'd be able to connect you with. Like I said, when you contact our agency through our information and referral or community services, they would be able to basically, they're going to ask you the questions that they need to know. You need to contact, you know, Alpha One, or you'd need to contact Elder Independence of Maine, or you'd need to contact one of the other organizations that exist out there.
You are really the starting point.
Yes.
Whatever needs there may be.
Right. We don't offer, as I mentioned, we don't offer every comprehensive program of services, but that's one of the things, being able to work with the towns and communities in knowing what's available and being able to connect. Perfect. Thank you for summing that up so nicely, eloquently.
What about like 55+ communities, you know, so you can age in place? Maybe you want to downsize, but I mean, you're not ready for assisted living or any of that, but you want to downsize.
Yeah, we're able to provide you with all of that information. And I'll get on the website. That's a good segue because I can show you, because we just revamped our website, and on our new website, we have some of that information available that you can look at, so you just don't have to just call. You can find that information on your own. So I think that's it. That's our contact information. I think that's one of the nice things about being in these communities, is learning what other additional resources that there are and availing yourself of those resources. So, well, thank you all.